Okay, so we have here the other species of your Staphylococcus. So we have your Staph epidermidis. So your Staph epidermidis is a normal microbial flora found in our skin. Okay, but eventually, in some cases where the skin has been damaged, it would have here the tendency to develop here an infection. Okay, so your Staph epidermidis would have here the following virulence factors. So it contains here the biofilm and the slime layer. So biofilm is just a community bacteria. We try to form here para siyang film, okay, that would allows the bacteria. So para siyang may layer ng film, inside that one, nandun ang mga bacteria natin. That would prevent it to be recognized by our phagocytes in order for them to cause an infection. Slime layers being used by the bacteria primarily for their adherence, for attachment to your tissues. Okay, but eventually, so since the most likely the biofilm here is being produced on mga artificial devices, medical devices inside the body of the patient. So therefore, try to cause infection associated with your medical devices. As I review again, that's your iatrogenic infection. Okay, so infection caused here by staph epidermidis associated with your medical devices. So it could cause your hospital-acquired urinary tract infection or even your endocarditis. Carditis your heart, so that's the inflammation of your heart because primarily of the implantation of your artificial heart valve processes. Where this bacteria, staph epidermidis, were able to form here your biofilm and eventually try to cause infection through your iatrogenic infection with your medical devices. Okay, next we have your staph saprophyticus. The Staphylococcus saprophyticus here basically contains the adherence protein that would allow it to adhere to the urogenital tracts. Pag sinabing urogenital tract, that's your kidney. Okay, so urogenital, so more of the kidney and sexual organs. Okay, so this saprophyticus try to cause here basically urinary tract infection among sexually active young women and even in older patients having the catheter, indwelling catheter attached to them. Okay, next one, we have your Staphylococci. Okay, the Staphylococci would have here coagulase negative. It might have here coagulase positive na test result on the slide method, but not on your tube method. Okay, the variance factor of your Staphylococci would be your MEC-A gene. So this is the gene that try to code here for this bacteria to be resistant to your oxacillin. So never ever give oxacillin for the Staphylococcus lugdunensis because this one contains the gene MEC-A gene that would confer this bacteria to be resistant with your oxacillin. Infection, so nosocomial, urinary tract infection, saka endocarditis. Staph hemolyticus, on the other hand, is variance factor confer this one to be resistant to your vancomycin. So again, never ever give vancomycin because it will not be effective against your hemolyticus. So it try also to cause here urinary tract infection and some of your endocarditis, which are nosocomial infections. Okay, so we have also here the laboratory diagnosis. So specimens, okay, when we're doing here the specimen collection, you could have your swab or you could also have here your assay. So we're doing a swab. So basically, if the wound infection here is superficial, but if the wound infection, for example, here is a deeper in the wound, then we need to aspirate our specimen. For the culture media, so we have your blood agar. Blood agar is considered to be an enriched culture media for isolation of your staphylococcus. So it's enriched because meron siyang blood. Then we also hear your CNA or cholesterol lactic acid plus or phenylethyl alcohol. So that one is considered to be as your selective na media. Selective media, so basically try to allow the growth only of your gram-positive organism like your staph, but not your gram-negative organism. Then we have your MSA, is maltose salt agar. It's selective because again, it would only allows the growth of your staphylococcus. It's differential because it would differentiate your organism or Staphylococcus here is able to ferment your mannitol or not able to ferment. Pag mannitol fermenter, it would have here the pink na colony. But if that one is non-mannitol fermenter, it would have here a yellow na colony. Now we have here the colony characteristics or the cultural characteristics. Okay, Staphylococcus aureus would produce here medium to large na colony size. That one is extremely white, translucent, and is beta hemolytic. Staphylococcus epidermidis on the other hand is a small medium na colony size, is still translucent, but usually gray ang color niya, and that one is non-hemolytic. On the next one, we have your Staph saprophyticus. Staph saprophyticus here with a large colony, but that one is color yellow to orange, or could be white, yellow to orange. Then that one would have here, eventually would have here the opaque colony, and that one is non-hemolytic. Staph hemolyticus and Staphylococci that are both na medium size na colony. Only that your Staph hemolyticus would have here weakly hemolytic reaction, whereas your Staphylococci would have here hemolytic, is that one is hemolytic, hemolytic. Okay, now we have here the differentiation between your Staphylococcus and our Micrococcus. So Staphylococcus would have catalyst, both of them are catalyst positive. For you to differentiate that one is your microdase test or your modified oxidase. This is your oxidase test that will only give a positive result with your Micrococcus, but not your Staphylococcus. In terms of their gas requirement or gas requirement, so your Staphylococcus will consider it one as a facultative anaerobe. So being facultative anaerobe, it could grow here in the presence of oxygen or even in the absence of oxygen. Whereas your Micrococcus is one strict or obligate aerobe. So therefore, just grow here in the presence of oxygen, they die in the absence of oxygen. Another differentiation with our antimicrobial susceptibility testing. So Staphylococcus here would have, so we have different antibiotics, cetirizine, furazolidone, and we have your lysozyme. Staphylococcus would be resistant to your cetirizine and your furazolidone. Mean to say that one, Staphylococcus is not this antibiotic here, but cetirizine, furazolidone is not effective against the Staphylococcus. Whereas in the lysozyme, that one would have a susceptible results, signifying that one is effective against the staph infection. Micrococcus on the other hand, so it would have a susceptible result because it is furazolidone, it will be effective against your Micrococcus. Whereas your lysozyme will not be effective against your Micrococcus because it would have here the resistant result.